We have to keep in mind that nothing is 100% safe in pregnancy. So really the question is what's safer, right? So Tylenol is still safer in pregnancy than a lot of the other options, even though it's not 100% safe, right? But it remains first line. Reglan, so that's metoclopramide, which is an anti-nausea medication that also helps with headaches via a different mechanism. NSAIDs, unfortunately, are generally not a good idea in pregnancy. There's a very narrow interval of time, usually in the second trimester, where they can be used, but in the first and third trimesters, they can lead to cardiac problems in the fetus and other issues. Steroids are sometimes used. Sometimes even opioids can be used in pregnancy, depending on the stage as well, but that can sometimes be safer than using some of the other medications in select cases. Another medication that we use commonly in pregnancy is magnesium. One intervention that I generally recommend and that OB also likes, for pregnant women who are having headaches, are occipital nerve blocks, because those usually only contain local anesthetic and steroid, and they tend to be safer than a lot of the medical options that people have to take on a day-to-day. SPG blocks, sphenopalatine ganglion blocks, are another reasonable option that we use sometimes. So unfortunately, Botox and CGRP medications like Nurtec and Ubrelvy and Qulipta, we don't really have data yet on their use in pregnancy. So they're generally not advised, but that's not because they lead to problems, it's simply the lack of data.